This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share this week's update for the global pandemic of COVID-19. Before we start, I'd like to extend our very best wishes for a fast and complete recovery to the President, the First Lady, all the people around our country and around the world impacted by this pandemic. As we said before, the pandemic began in late 2019 and began to spread such that by early March, there had been 10,000 deaths around the world. That number reached 100,000 less than a month later, 500,000 a couple of months after that, and it's been growing inexorably ever since, such that this week, for the first time, it's passed 1 million deaths in the world, 35 million confirmed cases, and about a 6% growth rate over the past week. As I've said before, it's important to remember that this is a significant underestimate because there are many places in the world that don't have the ability to test or report their disease. It's also important to remember that this is not the pandemic isn't affecting every country equally. There are some countries like Belgium, France, Spain, which saw a very rapid growth in the number of deaths in early March and April, and then have been essentially growing at less than 1% a week since then. There are countries like the United States, which appear to be slowing down, but have not yet plateaued, as we've seen in Europe, countries like Brazil that are growing a little bit faster, and then countries like India that are growing faster still. Again, this is seen graphically here where the pandemic began in China, then spread, it looked like, primarily to Europe, North America, and then by late April was pretty much everywhere in the world. In late April, created this list of the top 17 countries in terms of deaths per million. A month and a half or so later, it looked like this, and now it looks like this. And the reason I show you this is that if we color code North America in dark blue, leave Europe in white, and color code the South America in red, you can see very clearly that in late April, this was largely a European pandemic. By the early part of July, it was spreading pretty widely. And now many of the countries that are most affected are in South America and North America. The other thing that's important to look at on this chart is to see that the growth rate, the number of deaths per million has grown across the world. Even countries like the United States, which was 10th and then 7th, and then 8th, has seen about a 5-fold increase in the deaths per million. So an evolving pandemic that's affecting everywhere in the world. Again, as we've pointed out before, early on it hit China, and then primarily Europe, and most recently the Americas, and now spreading into Southeast Asia and other parts of the world. People have resonated with this list of the top 25 most serious pandemics in recorded history in terms of number of deaths. And with this week's update, COVID-19 is up there with a couple of other serious pandemics that were reported to kill up a little over 1 million people. Again, this is a little bit difficult because obviously a couple thousand years ago it was hard to estimate how many people died. It's also important to remember that the world's population has quadrupled just in the last century. But nonetheless, it puts COVID-19 up there as the top 24 or so pandemics in human history. There are 3 of these diseases that are still going on today: tuberculosis, HIV/AIDS, and COVID-19 in terms of being a pandemic. And the reason I want to highlight this is that tuberculosis is estimated to kill 1.5 million people a year. AIDS kills about 1 million. COVID-19 is, by the time this 1 year is done, will probably be somewhere in the middle. So a very serious pandemic affecting countries around the world. It's still evolving and changing. It still needs to be taken very seriously. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please let us know. As always, I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. If you have any questions, comments, concerns, uncertainties about COVID-19, please let me know. A number of you send me emails. It's very helpful to me because it helps me understand what issues are evolving, what issues are of concern to you. I'll be happy to try to find answers for you. Thank you very much.